Hello, everyone. My name is Andrew Lent. My pronouns are he, him, and I am Equality Florida's healthcare equity trainer. Thank you all for joining us today for this town hall on the monkeypox and meningococcal disease outbreaks in Florida and how they impact the LGBTQ community. In the last several months, the Centers for Disease Control and Prevention and the Florida Department of Health have discovered these outbreaks, which have disproportionately so far impacted gay, bisexual, queer, and men who have sex with men. There's been a lot of confusion around the diseases, particularly around monkeypox, which is a new concept for a lot of us. And today, I'm so grateful to have two medical experts, Dr. Asa Oxner and Dr. Jonathan Tolentino, to answer all of your questions and mine as well. So thank you both for joining today. And can you give a little introduction, starting with Dr. Oxner, to your work and who you are?
Sure. So I'm Dr. Asa Oxner. I'm one of the primary care docs and HIV docs at University of South Florida and Tampa General Hospital. And I'm the medical director and practitioner for our needle exchange program as well.
Thank you, Dr. Oxner and Dr. Tolentino.
Hi, I'm Dr. Jonathan Tolentino down here at the University of Miami, Jackson Memorial Hospital. My pronouns are he, him, L. I am a general practitioner. I see both adult and pediatric patients, both on the inpatient wards as well as in the outpatient clinic. And I also work with the LGBT community here in South Florida.
All right. Thank you both for joining us today. And I'm glad we have a good representation of South Florida and the Tampa Bay area around the state. So basically, we're going to get started. And I have a list of questions. If anyone has any, please feel free to leave them in the comments and we'll do our best to get to them. But I want to start with the basics, especially with monkeypox, which is a disease that a lot of us hadn't heard of before, especially in the United States, a lot of the general population. Can either of you can jump in and start. But what is monkeypox? Just in general and layman's terms, and what do we need to know about it?
So Dr. Tolentino, you have more cases around your side. So you want to jump in on that one?
Yeah, so monkeypox is what is a particular type of virus that has originated from sub-Saharan Africa, that traditionally has been mostly endemic in that part of the world, where we generally don't see that virus here in the United States, or in mostly what we call non-endemic countries like in Western Europe or what have you. But this past spring, we started seeing more of this monkeypox virus coming through in European countries and here in the United States. And what we generally see with many of these patients are a lot of your typical viral type symptoms. So they'll have fevers, have the general sense of malaise, they'll get the lymphadenopathy, where they'll get the swelling in the glands and what have you. But they start developing these lesions, these little pox lesions, which basically look like little elevated wheels with a little indentation in the middle that can sometimes develop pustules, and then they kind of slough off. This particular virus is very similar in presentation to many other viruses, such as smallpox and what have you. But what we know about this particular virus is that it commonly is spread through a lot of different types of secretions, especially mucocutaneous secretions such as your lips and what have you. We see this mostly affecting the LGBT community, not just here in the United States, but worldwide. And it's becoming more and more evident, especially coinciding with a lot of Pride events. We're seeing a lot of patients coming in with these non-specific symptoms and with these pox viruses and what have you. And I think this is one that we do see outbreaks of. And we're particularly worried about it because it's beginning to spread fairly much quicker than we expect. We don't generally see these many cases worldwide, and this is probably one of the biggest outbreaks of monkeypox that we've seen in this generation.
Yeah, and you brought up some great points, and especially talking about, I've seen a lot of exposures from Pride events, and you talked a little bit about transmission. I want to clear up some of the misconceptions that I've seen on social media with people sharing their experiences, and there's been a lot of concerns. So how can it be transmitted? Because I've seen some people talking about it's only through sexual contact. Some people talking about, is it left behind on surfaces? So can you clear that up a little bit more, either Dr. Oxner or Dr. Tolentino?
Sure. So it's definitely spread by touching the lesions, the rash that Dr. Tolentino was describing. That is definitely how it's spread. It also can definitely be spread through the saliva or other secretions like vaginal mucus, etc., of patients when they are infected. And so because of that, in situations like concerts or something where you're shouting, where your saliva might come out of your mouth and spread and spray, that's how it can easily, that's those little tiny droplets of saliva can go, 3 feet or 6 feet, like we learned with COVID, and land on somebody else. So it's by touching contact with that, but sometimes you don't know that you're coming in contact with it. In terms of whether it could persist on surfaces, they are studying that. I actually read something yesterday from the Association of Hospital Environmental Services that cleans hospitals, and they do suspect that it's still left behind on bed sheets and some surfaces where, bacteria and viruses can grow. So you wouldn't expect it, for example, on like metal or some kind of, maybe a desk, something slick, but something that's porous, like, cardboard or fabric, then you would expect it could probably live in the little tiny grooves of that.
Yeah. And the other thing, I think one of the things that where people start saying is it sexually transmitted is what makes monkeypox so different in this particular outbreak. So typically the rash usually appears on the face and all throughout the body, but and we're seeing a lot of atypical presentations of monkeypox where it's appearing in the genital regions or the perianal regions, and it appears very much like many sexual contacts or many sexual transmitted diseases would typically present as. I think the thing to remember about monkeypox is that you can get it through non-sexual contact. Kind of going back to what Dr. Oxner was saying was that it's just, if it's in the air, if you're in a crowded area and somebody is infected with monkeypox, and what's hard about monkeypox is you don't necessarily get the lesions immediately when you start having symptoms. Most people have these non-specific fevers and the lymph nodes, and it looks like it's just a viral illness, or they just may feel bad. But the minute that you start having symptoms, you technically are infectious, and especially when we think about respiratory droplets and you're coughing it out, like Dr. Oxner was saying, you can spread that very easily. Or if you're kissing someone, or you're spitting on somebody by accident or something like that, that can spread the monkeypox virus. So while we see it disproportionately affecting the LGBTQ community, anybody can get this disease. Anybody can get this virus, and I think while it's affecting our community in particular, I think this is one where this is it doesn't matter. It's not discriminating against or it doesn't have an affinity for one group or another. And this is something that we have to be very careful about when we're talking about how it's transmitted and in which groups it's being transmitted to right now.
Mm-hmm.
Thank you for also clearing that up, because we've seen, I know I was talking with both of you before, some tendency to kind of make it seem like a gay disease, similar to what we saw Dr. Fauci was talking about with his work with HIV and AIDS, where people were only saying it's only a gay issue, only gay men specifically can get it. So thank you for clearing that up, first of all, that it affects all of us, even though it has been so far predominantly the LGBTQ community. So we talked a little bit about prevention, and what I also want to touch upon is vaccines, because a lot of this at first, I saw a lot of parallels to the ongoing COVID-19 pandemic, where there was a lot of misinformation. People weren't sure about transmission, vaccination, what symptoms look like. So I know we've also had a lack of vaccination so far, and they're trying to get them out. But can either of you speak to what vaccines look like and also what treatment looks like? Because we know it's not nearly as severe as COVID. There are treatment available. So if both of you could kind of touch upon that.
Mm-hmm. You want to start, or you want me to start?
Why don't you start for this one?
Okay, great.
Yeah.
So there is a vaccine against monkeypox. It's a much older virus than COVID. COVID was a brand new virus. This has been around a long time in sub-Saharan Africa. So a vaccine had been developed ages and ages ago. We don't have a lot of it because we didn't anticipate having to vaccinate the whole world against monkeypox. So we do not have nearly enough supply to vaccinate everybody, but the state of Florida has already received 10,000 doses. They are spreading that among several counties, including Miami-Dade, Broward, Hillsborough, where we have our population centers that we expect that there's going to be the majority of cases. The vaccine's already been delivered to those counties, and the county health departments are working together to start getting, shots in arms. Same old story, like you said, with COVID. The phase 1 group who will be able to get the vaccine is going to be people who have had a high risk exposure, which would be coming in contact with a known case, especially if they're coming in contact with that case when they were not wearing a mask or not wearing gloves. So if they were in physical contact with that person without having PPE on, as we have all come to learn that term as well. And then groups of people who have HIV with a CD4 count less than 200, whether or not they have known contact or exposure. So those are the two categories. So in the first category of people with exposure, that could certainly be healthcare workers, but that could also certainly be lay people who know that they've been exposed to somebody either at a party or at work, place events, anything. And so there is going to be a lot of onus on the health department and on practitioners to do some contact tracing in the beginning until we get further supply of vaccine to where we don't have to restrict the initial population of patients who are able to get the vaccine. In terms of treatment for monkeypox, there is an antiviral called T-Pox that it, again, has been around for a while. We don't have a ton of doses, but we have some doses. And so we can prescribe that to patients. Like most antiviral medicines, it really works best if we do it super early. And unfortunately, like Dr. Tolentino mentioned, most people don't actually get the rash and they don't get diagnosed with monkeypox until like 7-8 days later. And so it's almost, too late, not quite too late, but we're getting to that point where it's too late to give the T-Pox antiviral medicine. So our usefulness of that is, I think for now, going to be a little bit limited until we get a better handle on diagnosing people really early, and potentially, contact tracing can help us get to that point where the medicine would be more helpful. But we do have it available. I don't know if Broward County has prescribed any doses. We haven't yet over here.
Yeah, because I think so the decision to use T-Pox and a lot of those medications are generally based upon also the severity of the disease. And as Dr. Oxner was saying, the majority of patients do fine in terms of they're able to get through the virus. It takes about sometimes up to 2 to 3 weeks for these pox viruses to actually slough off of your body. And once they slough off, you're no longer infectious. And most patients are actually able to do well afterwards. But for those patients who are at highest risk for potentially severe disease, and those includes patients with severe immunocompromised states, the very elderly or the very very young, or even pregnant women who get monkeypox and then start developing severe disease. Those are the ones that they consider starting treatment on. But the overall availability is very limited. Mostly because, just as Dr. Oxner says, we weren't expecting this, which happens a lot of times with these new outbreaks of some of these pandemic viruses. But it does create issues from that standpoint. In regards to vaccines, one of the things that many health departments, and you may have seen on social media, that many LGBTQ centers and health departments in many locations with high numbers are really advertising, giving out the vaccines, especially for those who've had exposures. So, for example, Broward County today announced giving out free vaccines for monkeypox to the patient population, just because we know. So 70% of all the cases from monkeypox are happening here in Miami-Dade and Broward County, but disproportionately Broward County. And so the health officials of Broward County are very worried about the number of cases and that it's really centered here. Florida has the third highest number of monkeypox cases next to California and New York, and the epicenter is really here in South Florida. And so getting the vaccines, you can get them at the health departments. That's usually the easiest and fastest ways to get them. They're definitely available here in Miami-Dade County, Broward County. And if you're not sure if they're available in your health department, I would definitely call your health department, especially if you're worried that you've had an exposure, you've heard of an exposure at a party that you're at, or a friend or something like that. Because we know that it's fairly transmissible, and it can live on these what we call fomites, or like the clothing and things like that. Or if somebody had the monkeypox and it kind of fell off, and those skin cells are in different areas, and you're worried about that. I always err on the side of caution, especially when it comes to protecting yourselves as much as possible. Right now, there's not enough vaccines to do a population-wide vaccine drive, and so we're really targeting those who are at highest risk based upon their exposure.
Thank you for that, especially clearing up eligibility for vaccines, because I don't know about other people, but every morning I've kind of been Googling, are there vaccines available in Hillsborough County, just because I want to be prepared as someone who knows about public health, but also just as a member of the LGBTQ community. There's been a lot of concerns and fear. And before we move on to meningococcal disease, I think we have some questions in the chat. So if you guys wouldn't mind answering some of those. So can Dr. Oxner repeat the comment about exposure risk for people living with HIV and the access to vaccines?
Sure. So people living with HIV who have a CD4 count under 200 are eligible for a vaccine, even if they do not have an exposure. They're in phase 1 eligible. And then everybody else, whether you have a HIV or not and control status or not, you're eligible for a vaccine if you have a confirmed exposure.
Thank you for that. And so just to clarify, should someone reach out to their health department, as you guys were talking about,
Yes.
if they qualify under having HIV or exposure?
Yes, for now, they should reach out to their health department. I know that the health departments are going to send some of the vaccine to the different HIV treatment facilities in every county. So, like Metro, Inclusive Health, CAN, all of those, they will get there. But I don't know if they are technically there yet, because they just received the vaccine on Monday. So probably at this point, your health department will have it, and those places will get it over the next week or so, but go to your health department for now.
Yeah. So, for example, the Pride Center at Wilton Manors up in Broward County is giving out free monkeypox vaccines, I believe, starting today. So it's being distributed definitely from the health departments and trying to get out to the communities. If all else fails and you're having a hard time figuring it out, contacting your primary care provider can also be another way to try to get access to more information about where to get the monkeypox vaccines.
Thank you both. And if there are any other questions? So if we're not certain whether we got the meningitis vaccine as a teen, young adult, should we get it again to be cautious? And do you recommend them for all adults? And we have a cis woman who's talking here. And I know that's also a question I have when we move on to meningitis, is I know I got one of them before I went to college here at USF. So I would also appreciate kind of the clarification here.
So if you are planning on going to college, yes, most of us have gotten the meningitis vaccine. So the thing to remember is that there are 2 meningitis vaccines. There is the traditional Menactra, which has certain types of what we call serotypes, A, C, W, and Y. And those vaccines are given twice, once when you're a young teen and once before you go up to college. And the second one is meningitis B, which is generally a 2-stage or 3-stage vaccine. And that meningitis B vaccine covers another type of meningitis. And there's all kinds of, I call them meningitis cousins, and they all hang out and they all cause problems for us. And so now the recommendation right now, because of the concerns about the meningitis outbreak here in Florida affecting the LGBTQ community, is the recommendations is to actually protect those who identify as LGBTQ to actually get the vaccine for the Menactra or the ACWY vaccine. And that's because the particular serotype that is affecting the LGBTQ community here in Florida is a meningitis C serotype. And so right now, if you do not identify as LGBTQ, that guidance is not necessarily geared or directed towards that particular population, but definitely towards the LGBTQ community. And again, and mostly has been focused on gay and bisexual men as well. And so this particular stereotype has been known to actually cause outbreaks in other cities in the past, mostly in the LGBTQ gay and bisexual male communities. And so for you in particular, this one may be one where I would talk with the healthcare provider, whether you feel that it's necessary for you, but the general guidance isn't as targeted necessarily for cis monogamous women.
Yeah, and so also for that, just to answer kind of part of that question again, if we aren't sure if we've gotten it before, is there any harm in getting it again?
Not necessarily, no.
Okay. Thank you. Because a lot of us, I think, kind of remember, but especially if it was a long time ago, aren't sure. So that helps clarify.
Mm-hmm.
And then we have another question. If you've never had chickenpox and got the vaccine, do you have to worry about monkeypox?
Yes, so they're different poxes. So they don't have cross immunity. So you would still be, susceptible to getting monkeypox.
Yeah, I know a lot of times with the names, I get confused too when you hear all the different poxes. So that's a good question.
Yes.
And one thing I kind of want to ask before we move on to meningococcal disease is, especially with the lack of mass vaccines, because as you talked about, we weren't necessarily prepared. It's not something we see. What would you say to the LGBTQ community who's really concerned, especially as seeing they can't get a vaccine yet, just kind of to quell their concerns and fears about it? What would you say directly to them?
I think I would say that as always, try to practice safe sex, try to even now avoiding crowds or being in crowds that are limited numbers. Generally the number that the CDC has thrown out is, 25 to 30 people is going to reduce your chances of any of those airborne saliva droplets being tossed around, because people don't have to shout. They can tend to talk at a reasonable level, and so their spit doesn't go flying, right? So that's kind of like why that number is always thrown out, and it just has to do with the saliva droplets. So I know we've been saying that for 2.5 years from COVID, and unfortunately it's the same, and it's from COVID and now monkeypox the same. But that's going to be, the same kind of guidance as we had before. And, and then try to you can always ask people about their symptoms. They may know that they have a rash. They may have had some little scratchy throat thing a couple of days ago, but don't trust them, because they may not always tell us the truth.
Mm-hmm. And, to that point, as much as we hate it, and I know we're tired of wearing masks, but masking can also help, especially with the respiratory transmission from that standpoint. And I think a lot of the protective measures that we were using for COVID-19 could potentially be very helpful even in these cases. But I know it's hard, especially as there are still ongoing large events and people want to be together and what have you. Those are still, that's generally how a lot of these viruses take advantage of more people to kind of go one to another. And I think this is one where being mindful that there are outbreaks, being mindful that not everybody is necessarily going to tell you how bad they're feeling at any point in time. And we've all had these feelings where we feel off, but you're off, but not off enough that you can still go and do something. And so if you're sick, if you're feeling bad, the most important thing you can do to help other people from getting sick is to also stay home and not get sick and not expose yourself, whether it's COVID, whether it's monkeypox, or whether it's any of the other viruses. Because remember, the initial symptoms of COVID looks very similar to the initial symptoms of monkeypox. So you don't actually know which one you have, but we do know that both of them are highly transmissible in the right settings.
It's also good to hear about masking, because I know we've seen a lot of uptakes in BA4 and BA5, so it kind of has the double protection, protecting against all of these. Yes. So we see a question from Mary on YouTube. Have you seen anyone present with shingles after being exposed to or contracting monkeypox?
No. And so shingles is from the chickenpox virus that lays latent in your body. So we wouldn't expect to see shingles after monkeypox because it is a different virus. But the little rash of monkeypox can look kind of like the rash of shingles. So, and both of them have that a painful. They can be really painful. The bumps can actually burn and sear, and so it might seem like the same thing. And right now we are sending, when we are swabbing those bumps, we're sending it to look for shingles or monkeypox or herpes.
Yep. And we know that I can be very confusing because we know that shingles can also occur, especially during, we know that it takes advantage whenever there's a slight blip in your overall sense of immunity or your overall immune system's times of stress and what have you, and we can sometimes see shingles outbreaks. If you're not sure what it is, always seek care from a healthcare provider to help better understand what's going on. And many of us are double testing because of kind of what Dr. Oxner was saying, is that we don't exactly know what it is going to be, and we know that the rashes can appear to us in different stages. We just have to be very careful.
Thank you for clarifying that, because I think it's also helpful to a lot of people to know that it's also being tested sometimes for herpes and for shingles, because I know especially with herpes, there's been a lot of confusion because, like, as you said, some of the symptoms can present the same. So thank you both for that. I hope for monkeypox that was helpful for a lot of people. Of course, we'll keep answering questions, but I kind of want to move on to meningococcal disease, because that's kind of the first one we saw the Centers for Disease Control and Prevention say specifically in Florida that we've seen a lot of outbreaks. And I know we're much more familiar with that. Vaccines are more readily available, but if we could just start by saying what it is and kind of what the symptoms present as.
Sure. So meningitis is a bacteria, unlike monkeypox, which was a virus. Meningitis is a bacteria. It is really worldwide already. It happens in outbreaks worldwide and has for 100 years. We've known that this was happening. It's also spread by those respiratory droplets, saliva droplets, sharing mucus in any way. That's also how it's spread. And when you get infected, it goes into your bloodstream, and that's how it travels into your brain. And so the meningi are the coating around your brain. And that's where it really takes and lives and replicates and causes inflammation of the coating around your brain, which is why we call it meningitis. And, patients can be really, really sick from meningitis because it is in your brain. That's a vital organ and a very delicate organ that can't take a lot of, messing around with it. You get fairly sick fairly fast. The classic symptoms are really, really bad headache, terribly high fever, and then you start to get kind of very sleepy, somnolent. And so if you're having those things together, sure, that could be COVID, that could be monkeypox, but it's worth going to get checked out at your primary care or at an urgent care around you to make sure that they don't think that it's something worse like meningitis.
The hard part about meningitis is that if you do have meningitis, and while our treatments have gotten a lot better over the past several decades, as we've gotten better at figuring out which antibiotics to use and which medicines and treatments to use, and so our overall fatality rates has improved dramatically. Patients who survive meningitis go on with a lifelong a set of symptoms, anywhere from hearing loss to being neurologically devastated to having severe cognitive issues and having a hard time being able to actually function afterwards. And so while the actual number of patients who have had meningitis here in Florida seems really low, we know that every case of meningitis is a huge, severe case. And to see this uptick, as we've seen in this past several months, really scares us as physicians, because we know how neurologically devastating and how just overall quality of life devastating meningitis can be.
Yeah, and from what you both are saying, it can be, especially if untreated, a lot more severe, especially because Dr. Oxner, as you said, it involves the brain. And Dr. Tolentino, you touched on vaccines earlier, but I kind of want to go back to it. Where can someone get vaccinated for it? Because I know it's much more available. And you said specifically it's being recommended for gay, bisexual, men who have sex with men. Are there any kind of age requirements that I know go along with any vaccines, or any kind of concerns like that?
Yeah, so the good thing with the meningitis vaccine is for most adults, there isn't an age requirement. We do have for our pediatric patients, but for adult patients, there isn't necessarily an age requirement from that standpoint. And because this is a vaccine that is actually more commercially widely available to practitioners and doctors all around, you can go to your primary care physician, you can go to health departments. Some health urgent care centers that also double up as a primary care clinic can sometimes also have the vaccines on stock. But it's much more readily available, much easier to get, and to get this additional vaccination can be life-saving and protecting you from getting this devastating disease. And so, especially for those men who have sex with men, patients who have immunocompromised states, including sickle cell patients with certain types of immunodeficiencies, they're the ones we're really targeting with this particular outbreak, because we know that this particular serotype is particularly aggressive, that we want to make sure that we're protecting as many people as possible who are most vulnerable, and those groups that are being targeted that have seen the largest people with the actual disease process.
Mm-hmm.
I have two questions after.
There should be plenty of vaccine. So just to emphasize what Dr. Tolentino said, that for meningitis, there's plenty of vaccine. Yeah. So if you are in any way, living in group housing like dorms or some other form of group housing, or if you're LGBTQ, just go get vaccinated. Yes. There's a lot of it. There's plenty.
That tends to be our standpoint in public health. If you can get vaccinated, please get vaccinated. Yeah. One thing I want to ask also, because we were talking about the monkeypox vaccine earlier, specifically, how many doses does this take? Is it a 1 dose, 2 doses? And then also with monkeypox, if there was an exposure, we know you said earlier, Dr. Oxner, that it's recommended you go get the vaccine. Is this a similar one where you think if you've been exposed to meningitis, you should? Because I think that might be helpful for people to know.
So that's a great question. So actually, it's a little complicated. For meningitis, if you've been exposed to a known case of meningitis, we actually treat you with antibiotics specific for the meningitis bacteria, and you can get vaccinated. So you would do both, but we do give post-exposure antibiotics to people exposed to meningitis. So if you have a friend with meningitis or you hear about it, go ahead and get the antibiotics. And that's rare because you guys know we try not to give people antibiotics. So seriously, that's how serious we take the meningitis thing, okay? So that was part of your question. Then what was the part of the question? How many doses is the vaccines? Okay, so monkeypox is a 2-dose vaccine. So we're starting with dose 1 now. I think it's 4 to 6 weeks for dose 2. I'd have to check again on that. And then the meningitis is also, it's a booster dose is what we're really doing for people, but the other meningitis vaccine has multiple doses, but that's not the one that we're doing now for the outbreak.
Right. So you may have heard of other outbreaks. There was actually a college-based outbreak a few months ago, which is different than the outbreak we're dealing with right now. And the meningitis B vaccine, which is the other one, is not the targeted vaccine that we are worried about right now. But if you do hear about, and again, it depends if you're in this one particular college, in this one particular outbreak, they may recommend a meningitis B. But for this particular guidance for the LGBTQ community, this is for the ACWY or the Menactor vaccine that we're particularly worried about.
Yeah, that's good to know, because I think that there's a lot of confusion, even myself, about do I need meningitis B? I'm pretty sure I had the other one for school. One thing I also want to know is we've been talking a lot about stigma with the LGBTQ community. How can we educate LGBTQ folks without making them feel like this is an only them issue? How do we kind of get that message out? I know both of you kind of gave your thoughts before, but I know I got that question from someone. Yeah,
so from my standpoint, so identify as a gay man. And, when this first came out, the first thing I thought of was, gosh, another thing to stigmatize our community, right? And then when meningitis came out, and then when the monkeypox virus came out, then it felt like another a paper cut, right? And what I particularly really think of is one, reaching out to the LGBT community, first focusing on the fact that this is affecting our community, and that past the stigma, my first thought is we have to protect our community. We have to make sure that they are getting the healthcare, they're getting the access, they're getting the information, and that and also when I think about the severity of the diseases that we're seeing, or the spread at which is affecting our community, we really have to protect ourselves, and we have to make sure that everybody knows where to get the vaccines, when to get treatment, how to get treated, or what have you. But the other thing I emphasize when I talk to other people about how it's affecting the LGBTQ community is that this is not a quote unquote gay disease. This is not a disease just particular to the LGBTQ community. Did it affect our community first? Yes, but it doesn't mean that it's not going to affect other communities. And that the most important thing that we can do is assure that we are all doing everything we can to protect and to keep these outbreaks at bay. The more we stigmatize communities for saying that your certain behaviors or who you are is why this happened, the more that we allow these public health issues to become a bigger issue and worsen it for the LGBTQ community, but also have everybody else turn a blind eye to something that actually affects anybody. And so I really harp on with many of my patients, with the people I'm teaching at the medical school or in the residency programs, that we should be vigilant and understand the disease process and how we can protect the LGBTQ community and how this affects everybody else.
Yeah, I do many of the same things, and I always try to go back, especially when I'm teaching. I try to go back and I say, this is spread by droplets of saliva. So anybody who has a nose and a mouth who is breathing in air is going to be equally likely to get these diseases, especially monkeypox, meningitis that we're talking about. If I'm talking about HIV, I say anybody who is engaging in any kind of sex can get, or IV drug use that they are sharing, they're equally likely to get HIV. There's nothing special about the noses and mouths and sex and IV drugs of somebody who's LGBTQ versus somebody who's not. And so I people hear me say that all the time over here in Tampa, and it's honestly true. It's just, are you practicing safe measures like masks, condoms, clean needles, or not? That's what it really is. And it's more about harm reduction than it is about who you are or what your preferences are.
And the other hard part about monkeypox is that it's very visual, right? And so as a visual disease, it brings shame. And I don't want us to feel shame if we get the virus. And I don't want to shame others for being either dirty or unkept, or what other ways we think about marginalizing people when they get sick. What's the worst thing we do, unfortunately, as a society, is that if you get sick with a terrible disease, or you get sick with monkeypox or any other virus that's been located to one particular community, we automatically stigmatize them, and then we bring shame upon them. And we really should not do that. And we really should be focusing on, we have to get well, we have to get you through this, but you're still a wonderful person, and this has nothing to do about you as a person or anything about your character.
Mm-hmm. I think this also, hearing both of you speak, kind of calms any of my nerves, because it really points out also the importance of being LGBTQ competent among medical providers, which is a lot of what we do at Equality Florida, because a lot of doctors may know about monkeypox or meningococcal disease, but not specifically about the concerns of LGBTQ folks, or the way that you're messaging it, where it can literally be anyone, or you shouldn't be ashamed of having it, especially if it's more visual. That's not something to be ashamed of. And I know we're coming to the end of our time. We're actually 1 minute past. But this was such a great discussion. Do you have any parting thoughts or anything you want the public to know that we maybe didn't touch on?
I would say, keep in close contact with your local health department, your primary care doctor, and, as we get more and more availability of any of the monkeypox vaccines, we'll roll it out to more people. And for meningitis, stay with your radar up and seek care if you feel like you're, getting sick or if you've been exposed.
Yeah, from my standpoint, I echo a lot of the same thoughts as Dr. Oxner, and and the one thing that I always bring up is kind of going back to my prior comments is if somebody gets monkeypox, please don't shame them. Please help them, support them, and if they're worried about it, help them seek care. What I worry about is that the shame of monkeypox is going to keep people from actually getting the treatment that they need or being able to actually get tested to see if they actually have it or not. But aside from that, protect yourself, get the vaccines if you think you've been exposed, and please ask your doctor for any help. And if you're not getting help from your doctor, there's great resources all throughout the state of Florida. I'm here to help you.
Thank you both. I mean, it also just makes me feel a lot better knowing that we have people on the front line, advocates like both of you. I want to thank everyone for watching today, and hopefully that this was really informative about monkeypox, meningococcal disease, and that it kind of lets you know what the status is, what you all should do, and really important, what both of our panelists emphasized is there shouldn't be any shame. It's not a gay disease, and it's really about taking care of ourselves. So I want to thank you both again for joining us, and thank you everyone else. And I hope you all have a great day.
Thanks, guys.
Thank you all. It was a pleasure.